Okay, we are going to start with part one, which is focused on homeostasis. Homeostasis is basically, especially within the body, is a process which helps us maintain a good environment to keep us alive. And with external changes or things we consume or certain bacteria or allergy, our body needs to find ways to fight against those things. And so at each one of these different pathways or ways the body handles these changes, there is a set point. And so some examples that we could have that needs to stay within range could be temperature, pH, or even blood glucose levels. And within these, we have a range here. Within this range, we have a little area we consider the set point. And so a good example of this is within temperature. Let's say outside sources, the temperature increases to a hotter temperature than within the body, which is about 37 degrees Celsius within the body, but let's say it's really hot, 50 degrees Celsius. And so our body needs to find ways to bring this temperature on the outside down as we feel it on the inside, so we can keep our body functioning in the correct ways. And we do those things through a pathway that we call the reflex control pathway. And so within the reflex control pathway, we have multiple components. We have the sensor component. So this would be sensors like, in this example of temperature on our skin, that sense things are getting hotter. And through that, we have an afferent pathway, which goes from the sensor to our control center, which most of the time is our brain. And so the skin would send a signal saying, okay, it's really hot. And it would go to the brain through afferent pathways, so it's towards the control center. And then we have efferent pathways, which is where the control center sends a signal out for the body to things called effectors. And these effectors are basically what their name implies. They affect things, they carry out a response. In this case, it would be like sweat glands producing sweat to help cool down the body. So the efferent pathway would send a signal from the brain to the effectors, or the sweat glands, to then lower the temperature back to around our physiological set point where we want to be to keep our body functioning. And that is basically how our reflex control pathway works. And then we also have a couple different ways this is carried out. In this case, we have something called a negative feedback loop. And so here is our range of where our set point is. Let's say this side is temperature. We can say just degrees Celsius. And this is time. And so our body is going to be fluctuating here, back and forth. And when it goes back and forth like this, it's our body controlling the negative feedback loop by carrying it back as it goes up. Here, the body stops it and brings it back within this range. So as it fluctuates, the main point of a negative feedback is to keep it within its set point. And on the opposite side of that, we have something called positive feedback. That's where, and this isn't as common in the body, most bodily functions are negative feedback, but positive feedback's where you have, let's say, in this case, a good example is during childbirth. This is one of the prime examples of a positive feedback loop. The body, during labor, contractions will cause a release of oxytocin. So let's say this oxytocin levels before contractions start. And then as contractions start, they will release the oxytocin, which will then lead to more contractions and release more oxytocin, which leads to stronger contractions, and then cause delivery to happen, which in this case, this positive feedback loop occurs until delivery, and then the oxytocin levels will drop back down within the normal set point of the body. And so that's a prime example of positive feedback. A good example of negative feedback is most systems of the body. We could use that skin example, or we could say like within the pancreas, the body could release glucose as, let's say, blood sugar levels rise, and we want to start storing that glucose, so there's a release of insulin from the pancreas. So we have sensors in our body that would sense the rise of blood glucose, send a pathway to the brain, which then sends an efferent signal to the pancreas to then release insulin, which would then lower blood sugar to bring it back within the range we want it in our blood. And so that is the two examples there for positive and negative feedback.